Dear learners, welcome to yet another module of the Swayam MOOC course on Geography of Health and Well-being. We will continue with the topic on determining factors of health and well-being, and today we will cover socio-economic, socio-cultural, political, demographic and genetic factors. The socio-economic factors are at play at various levels. These may be availability and accessibility of health services. There are inequalities in the spatial distribution of health services, with metropolitan cities having better health infrastructure compared to villages or small towns. Furthermore, there exists a second layer of inequality regarding the access to health services. Additionally, people from all income groups cannot afford the same level of health services. Disparities in access to hospitals and high quality treatment are highly dependent on the socio-economic status of individuals. Ability to meet basic needs. The ability of an individual or households to meet their basic needs, including nutritious food, proper shelter, and availability of clean drinking water, toilet, and hygienic surroundings. Opportunities for education and access to healthcare are governed by one's socio-economic factors that in turn determine the health. Capacity to overcome illness. Higher income ensures a good quality of life and also enables affordability to better health care infrastructure and personnel. Equity and inclusion. Equitable socio-economic conditions promote equal opportunities for all, regardless of their background. Determining risk, exposure, and vulnerability. Exposure to risk, such as exposure to air pollutants, availability of clean drinking water, lifestyle and habits, quality of food that one consumes, and other natures of vulnerability are dependent upon socio-economic conditions. Now let us discuss some socio-economic factors that can influence health. The first and very important is income. Income is related to health in three ways: through the gross national product of countries, the income of individuals, and income inequalities among rich nations and among geographic areas. In a lot of literature on health equity and health disparity, the relationship between income and health have been focused on in the fields of economics, public health, and welfare economics. While many researchers conclude that rich are relatively healthier, even the World Disability Report states that 80% of the people with disabilities, which constitute the 15% of world's population, live in low income and low and middle income countries, which also supports this conclusion. The question then is, if income is a determining factor of health, then will the increasing income ensure better health? If yes, then what should be the entry point of health intervention policy? The health inequality theory proposed by Robert Easterlin presents two possible explanatory paths or hypotheses. First, the absolute income hypothesis, and the second is the relative income hypothesis. The absolute income hypothesis suggests a direct relationship between individuals' absolute income and their well-being and quality of life. It emphasized the positive effect of income on health that starts with the external macro mechanisms to explore the influence mechanism. It believes that the increase of the absolute income means the development of the macroeconomy, which is conducive to improvement of supply of common resources concerning education, medical health, social security, and improvement of such resources helps in the national health levels. The hypothesis has been supported by many researchers. However, it has also observed that when the income level exceeds the threshold level, its marginal effect will weaken and health will have little to do with income. On the other hand, the relative income hypothesis is based on relative income, that is, income of an individual in comparison to another individual. It is based on the rank of individuals in income distribution sequence. From this perspective, rich people have more critical resources, for example, knowledge, power, prestige, and favorable social relations to avoid risks and reduce diseases. The perspective of social psychology considers that different income groups face different psychological and social pressures. The low income group faces bigger psychological pressure and stronger sense of social deprivation and sense of lack of control, which are related to a series of health problems. When researching a happiness topic, the American economist Easterlin found that happiness is independent of income in the long run, and so is health. Money as a resource can affect health in a number of ways. People need certain level of income to afford basic needs of healthy life, such as food, water, and shelter. This pertains to mainly physical health. However, earning above average enables one to have more choice, that is, to choose for healthier lifestyles and options. The level of income also determines the kind of disease one may be exposed to. On the one hand, it is believed that higher income individuals may have higher financial stability, that is, better access to resources and quality of life, thereby lower stress and morbidity levels. On the other hand, many scholars refer to some diseases as diseases of the rich or diseases of affluence, namely hypertension, type 2 diabetes, and obesity. Lower income group and countries face health illness related to malnutrition, unsafe and unhygienic living conditions such as infections, allergies, and communicable diseases. Poverty. Mahatma Gandhi had always insisted that India would become truly independent only when the poorest of its people would be free from human suffering. An overwhelming concern for poor, a multidimensional view of poverty and human deprivations, the focus on freedoms, the need to expand opportunities and ensure its equal distribution are fundamental to a strong human development perspective. He further added, if human poverty is to be eradicated, attention must shift from income poverty to the poverty of inequality of opportunities, which are economic, social, and political. Poverty is a multidimensional phenomena that can be defined in economic and social terms. As a measure in economics, poverty is the minimum level of income to meet the basic needs, including food, clothing, and shelter, that is consumption. However, as a sociological measure, poverty is concerned with social participation. In 1978, the World Health Organization in the Alma Ata Declaration spelled out the dependence of human health on social and economic development. Ill health not only affects poor disproportionately, it also causes poverty. Rise in out-of-pocket cost for health, especially for private healthcare services, are driving many families into poverty and making poor people more poor. The magnitude of this situation, known as medical poverty trap, has been shown by national household surveys and participatory poverty elevation studies. The medical poverty trap happens when medical expenses such as healthcare services, screening cost, hospital bills, medication cost, or treatment fees deplete the financial resources so much so that families cannot afford basic needs. They are in debt and are pushed to take loans, perpetuating a cycle of poverty. Poverty also encourages poor people to make suboptimal choices that have damaging effect on their health. Low income and poor health, therefore, combine to form a poverty trap. Poverty traps happen at a regional as well as household level. Education. High level of education are often associated with improved health literacy, healthy behaviors, better job opportunities, and associated health benefits. Education provides crucial problem solving skill that can help reduce stress, thereby improving mental health. Occupation or workplace. Place of work may vary across sectors including primary, secondary, tertiary, quaternary, and quinary. Populations engaged in primary activities are directly dependent on natural resources for livelihood. This includes hunting, gathering, pastoral activities, fishing, forestry, and mining, also quarrying. People engaged in primary activities are called red collar workers due to the outdoor nature of their work. Secondary activities are concerned with manufacturing and processing industries. These activities transform the raw material received from primary industry to finished products. People engaged in secondary activities are called blue collar workers. Tertiary activities include both production and exchange. The production involves the provision of services that are consumed, and exchanged, which involves trade and transport. Tertiary jobs are also called white collar jobs. Quaternary activities are specialized tertiary activities in the knowledge sector. Personnel working in office buildings, elementary schools, university classrooms, hospitals and doctors, offices, theatres, accounting, and brokerage firms all belong to this category of service. Quinary activities, often referred to as gold collar professions, represent another subdivision of the tertiary activities, representing special and highly paid skills of senior business executives, government officials, research scientists, financial and legal consultants, etc. The highest level of decision makers or policy makers perform quinary activities. Each of these sectors of economy is linked to its unique health problems. For example, agriculture can be linked with poor health from malnutrition, malaria, foodborne illness, diseases caused due to exposure to pesticides and chemicals such as DDT and arsenic. Deep mines produce severe problems for workers in terms of their risk to high blood pressure, heat exhaustion, and nervous system disorders. Studies of surface mining focus on coal, granite, and rock mining and health risk related to dust inhalation. The negative consequences of mining for human health include respiratory complications such as pneumoconiosis, asbestosis, and silicosis caused by inhaling fine particles from the large amount of dust generated by mining activities such as blasting and drilling. Long-term impact include cancer, mental health problems, and some evidence of genetic disorders can also be seen in minors. Every year, 1.8 million years of ill health, disability, or early death can be attributed to the global burden of disease from mercury poisoning, small scale gold mining. That's over 650 million days or 15 billion hours of healthy human life lost through small scale gold mining make up only a tiny fraction of the global mining industry. Tertiary jobs are associated with higher incidence of non-communicable diseases due to higher stress and sedentary lifestyle. While there are some 110 million formal construction workers throughout the world, it has been estimated that an equivalent number of people work informally. The greatest share of construction takes place in cities and towns. Construction is one of the most hazardous occupations. Data from a number of industrialized countries show that construction workers are 3 to 4 times more likely than any other worker to die from accidents at work. Many more suffer and die from occupational health problems, including back injuries from carrying heavy loads, respiratory diseases from inhaling dust, musculoskeletal disorders, noise induced hearing loss, and skin problems. There is also a serious risk of cancer from the handling of asbestos. In the developing world, the risks associated with construction work are estimated to be 3 to 6 times greater in comparison to the developed countries. Another example is of the waste pickers or recyclers. Workers who deal with the waste picking or waste recycling generally are among the poorest and most vulnerable. Waste pickers are exposed to dangerous, toxic, and contagious substances. They sort through putrefying garbage to retrieve the scraps of material that will earn them a living without any gloves, mask, or preventive measures. In some cases, they also disassemble electronic devices through primitive methods at a risk of being burnt or poisoned by hazardous substances they inhale. This situation generates severe health problems such as leptospirosis, diarrheal diseases, typhoid, salmonellosis, influenza, musculoskeletal disorders, respiratory diseases, stomach pain, and cardiac problems, among others. Waste pickers in general face social stigmatization, verbal and psychological abuse with consequences to health. A large number of children also work in waste picking, exposing them to plethora of problems. The gender division of labor has impact on women's safety and health in the workplace. Violence, assaults, pregnancy and postpartum health issues are generally ignored worldwide. Similarly, home-based workers, part-time workers, and workers in the informal economy, child labor, migrant workers, face peculiar health illnesses but are not covered under safety and health provisions in many countries. Access to healthcare. Access to healthcare is quite dependent on income out of pocket expenditure and insurance or subsidies provided by the government. According to the World Health Organization, at least half of the world's population lack access to safe healthcare facilities. Emerging evidence indicates that improving health insurance coverage may promote equity and reduce disparities to access to healthcare. Socioeconomic policies play a crucial role in improving health through welfare programs, ensuring minimum wage, providing universal healthcare services, health insurance and subsidies, universal vaccination, diarrheal prevention programs, food assistance programs, occupational health regulations, and environmental protection regulations and acts. Next, we come to socio-cultural factors. Socio-cultural factors affecting health include race, ethnicity, gender and sex roles, immigration status, acculturation, social networks and social support, and psychosocial work environment. Culture consists of values, beliefs, habits, customs, and norms acquired by learning, which starts from childhood. Dietary preferences and food beliefs have close connection with ethnicity and culture. For instance, there is a clear north-south divide in the incidence of diabetes in India owing to rice as the staple food in South Indian population. Mediterranean diets include whole foods, vegetables and proteins, leading to lower rates of obesity and heart diseases. Similarly, the Japanese diet consisting of seafood, fish, rice, soy products and green tea is also associated with lower levels of obesity and cardiovascular diseases. Principles of sequence of eating, such as when to drink water, when to consume salad, sweets, etc., timing of food, are also rooted in our culture. The modern culture of fast food has swept the world with packaged food that is the cause of vulnerability to cardiovascular illnesses even in the young adults. Cultural beliefs and practices can affect health behaviors and decision making. For example, many cultures prefer traditional healing methods. Researchers have investigated the relationship between Tibetan medicine in treating chronic diseases, even Ayurveda in treating chronic diseases. Pregnant women in many Asian countries are advised to consume certain foods and despise some. Research have found a strong correlation between socio-cultural factors like traditional healing, faith healing, black magic, charm, rituals, and religious methods influencing mental health of people. Gender roles. Cultural expectations around gender roles can impact health outcomes. The rigid notions of masculinity may encourage boys and men to smoke, take sexual and other health risks, misuse alcohol, and consume drugs. Cultural norms around family and community ties can influence the support system, which is vital for mental health and well being. In some cultures, where strong family ties are emphasized, individuals may have access to strong support networks, reducing stress and improving overall health. Poor social ties, on the other hand, has been linked to depression, loneliness, and isolation. Discrimination and social inequalities may be based on religious, racial, or sexual orientation that leads to mental health risk. Discrimination due to race, gender, identity may also be an impediment to access to resources as well as further impacting health outcomes. The political factors are equally important for health outcomes. Government decision on healthcare funding, insurance, availability of resources, etc. is implemented through health policy. Effective laws and regulations can positively impact health outcomes, such as laws related to traffic rules, tobacco consumption, alcohol consumption, occupational laws, food safety, pollution regarding, and others. Political actions and good governance affect employment, housing, education, infrastructure, as well as health policies. Investment in public health infrastructure, including research, hospitals, and emergency preparedness, is crucial for responding to health crisis. Over and above, There is no substitute for political will to change for better. It was the role of political will that India became polio free by 2014, eradicated smallpox in 1980, and many other diseases. Political will can ensure honest data collection, research, and provide health care for all. Next, let us discuss the role of demographic factors in determining health outcomes. These may be age, gender, population density, migration, and others. Age is a significant factor in human health, as infants and older populations are more susceptible to illnesses due to lower immune systems. Age-specific mortality rates, infant mortality rates are considered to be the most useful indicators of population's health, so much so that infant mortality rate is a component of Human Development Index used for global comparisons. The rapid rise in childhood obesity is one of the most serious public health challenges of the 21st century, with the number of children and adolescents affected by obesity increasing more than 10 times from 11 million in 1975 to 124 million in 2016. Children are vulnerable to adverse health effects from indoor and outdoor air pollution, which causes an estimated 7 million deaths per year. Road injury is another leading cause of death for children and young people aged 5 to 29 years. And more than 1 billion children, half of all children in the world, are exposed to violence every year. In 2018, 1 billion people had moved or were on the move either as internally displaced persons, international migrants, or refugees, including many children, as a result of conflict, violence, inequality, and lack of opportunities. This leads to mental health issues. Cancer is a leading cause of death for children and adolescents. The likelihood of surviving a diagnosis of a childhood cancer depends on the country in which the child lives. In high-income countries, more than 80% of the children with cancer are cured. But in many low and middle income countries, less than 30% are cured. For older adults, good health ensures independence, security, and productivity as they age, yet millions struggle every day with health and safety challenges such as chronic disease, falls, mental health issues, all of which can severely impact the quality of life. Older adults are disproportionately affected by chronic conditions such as diabetes, arthritis, and heart diseases. Gender. Globally, the life expectancy of women is higher than men. But longer lives do not mean healthy lives. Higher proportion of women are dependent on men for financial support. Their health illnesses are also unique. This may include reproductive health, mental health issues, eating disorders, osteoporosis, which is a bone disease, dementia, and Alzheimer's disease. Sexual and reproductive health problems are responsible for 1/3 of health issues for women between 15 to 44 years. Two of the most common cancers affecting women are breast cancer and cervical cancer. Adolescent girls face a number of sexual and reproductive health challenges such as STIs, HIVs, and pregnancy. About 13 million adolescent girls, that is under the age of 20, give birth every year. And complications from those pregnancies and childbirth are leading cause of death for many young mothers. Many suffer the consequences of unsafe abortion. On the other hand, adolescent men are more prone to substance abuse, mental health issues, respiratory illness due to smoking. Density of population. The density of population refers to the number of people per square area. The density of population is one of the factors for availability of resources. Higher density areas can lead to higher risk of communicable diseases, that is infectious diseases, may spread more swiftly, or due to lack of green and blue zones, the non-communicable diseases may also increase. Furthermore, high density living can contribute to mental health issues due to increased noise, pollution, lack of green spaces, while low density areas might offer more tranquility but can lead to social isolation. Higher densities also pose a challenge in provision of healthcare services to all. This may lead to overcrowded hospitals and emergency departments, insufficient number of medical infrastructure and staff as compared to the demand. Migration. As per World Health Organization, there are some 1 billion migrants globally. These include 281 million international migrants and 82.4 million forcibly displaced people. In 2021, countries with the highest number of refugees fleeing were Syria, Arab Republic, Venezuela, Afghanistan, South Sudan, and Myanmar. While the countries hosting the highest number of refugees were Turkey, Colombia, Uganda, Pakistan, and Germany. Refugees and migrants often come from communities affected by war, conflict, disasters, environmental degradation, or economic crisis. They undertake long and exhaustive journeys with inadequate access to food and water, sanitation, and other basic services, which increase their risk of communicable diseases, particularly measles and food and waterborne diseases. They may also be at risk of accidental injuries, hypothermia, burns, unwanted pregnancy, and delivery related complications. Refugees and migrants remain among the most vulnerable members of the society, faced often with xenophobia, discrimination, poor living, housing, and working conditions, and also inadequate access to health services despite frequently occurring physical and mental health problems. The prevalence of common mental disorders such as depression, anxiety, and post-traumatic stress disorders tends to be higher among the migrants. Even during the sudden lockdown during the COVID-19 pandemic, millions of migrants traveled back to their villages on foot and thousands of them died in course of their journey. Climate change is the average change in average temperature and rainfall calculated for around 50 years. This may lead to extreme heat, cold, or rain. Climate change is a threat multiplier as it leads to disasters including heat waves, wildfires, floods, tropical storms, hurricanes, and they are increasing in scale, frequency, and intensity. Research shows that 3.6 billion people already live in areas highly susceptible to climate change. Between 2030 and 2050, climate change is expected to cause approximately 250,000 additional deaths per year from undernutrition, malaria, diarrhea, and heat stress alone. The direct damage cost to health, excluding cost in health determining sectors such as agriculture and water and sanitation, is estimated to be between 2.4 US billion dollars per year by 2030. The figure given below provides an overview of climate sensitive health risks, their exposure pathways, and vulnerability factors. Climate change impacts health both directly and indirectly and is strongly mediated by environmental, social, and public health determinants. Temperature and precipitation changes enhance the spread of vector-borne diseases. Recent research attributes 37% of heat-related deaths to human-induced climate change. Heat-related deaths among those over 65 have risen by 70% in last 2 decades. The biological or genetic factors. Although there are a number of causes of illness and disease, one of the most significant factor is genetics. Family medical history is often one of the strongest risk factors in asserting how our health will react to the environment. Some of the genetic diseases prevalent in different parts of the world are cystic fibrosis, that is common in people of European ancestry, Huntington's disease, that is common in Europe and North America, sickle cell anemia is common in sub-Saharan Africa, Middle East countries and India, Alzheimer's disease, which can be found mostly in Europe and North America, and thalassemia in Italy, Greece, Cyprus and India. With this, today we have covered the socio-economic, socio-cultural, climate change related, political factors and biological factors influencing health. Other than these, there are some other determinants that are contemporary in nature that will be discussed in the next module. But before that, ponder yourself with following questions. Why the deaths from cancer have increased exponentially in the recent past? What could be the shocking tale of cancer train that runs from Bhatinda to Bikaner? Is bottled water really pure, or is it contaminated with microplastics and toxic chemicals from their plastic packaging? With this, wish you good health and well-being. Thank you.